I'd like to welcome to the stage, and it's my honor to introduce Rasu Shrestha, the Chief Innovation and Commercialization Officer at Advocate Health, which is one of the largest healthcare providers. Rasu has spent over 30 years of his career in the innovation and healthcare business, and he is the visionary lead for all of the innovation going on at Advocate Health. So, Rasu, please.
Thank you so much. All right. So I took all of John Halamska's slide quota and incorporated it into mine. But I'm also, it's uncanny how the story that I'm going to tell you in the next 15 minutes really builds off of everything that we heard in the amazing fireside chat with Larry and Osama, and all of the great insights that John shared with us as well. And we didn't actually quite coordinate this. Maybe Gene did telepathically, so that's great. It's magic. But AI is not magic, it's math. There is a why behind what it is that we're doing, and there's also a how behind what it is that we ought to be doing. So today I'm going to talk about AI in moving from hype and hope, because there's a lot of those, to here. How do we make it real? The question that I always ask, especially in summits like these, conferences, multi-day events like these, where we have a lot of educators, we have a lot of students, we have a lot of industry folks, there's a lot of experiential elements of this, is not just what will you learn today, but what will you unlearn today? And I think that's really important. All of the historical elements of the last 40 years that you heard earlier on the stage, there are lots of things that have worked, there are lots of things that haven't worked. There are lots of paradigm shifts that are happening today, every minute. So what will you unlearn today? Just ask yourself that as you go through the story in the next 3 chapters that I'm going to present to you. Do what matters. I'll talk a little bit about augmented intelligence, and then I'm going to end it with the power of ecosystems done right, because I think it's important for us to understand that it is all of us. It's not just any one of us that'll make what we're talking about today a reality. So do what matters, right? So the question we need to ask ourselves is, are we lining up for the right movie? And this is not a political statement. This is not a statement based on challenging the evidence that is behind science. It is the reality of not just the United States, but the world that we live in today. I think that's important. In the last 30 years that we've been rolling out electronic medical record systems, PACS systems, EHRs, et cetera, this is essentially what we've done. We've erected an artificial wall that sits between the clinician and the patient. That's what we've done, right? Technology has become an impediment to care, an artificial impediment to care. My belief is that artificial intelligence will bring this wall down. It has the power to humanize care. Think about that. Artificial intelligence has the power to humanize care. Having said that, it's important for us to understand that we have to fix all of these broken workflows that we have in healthcare. There's a lot of things that are broken. You can't just apply a whole bunch of digital and AI and Gen AI to those broken workflows, right? If you apply digital to a process that's broken, you'll have a broken digital process powered by Gen AI, right? So it's important to do that. Healthcare is complex. It is challenging. I'm not going to go through this graph, but everything that we've lived out through the pandemic shows us the interconnectivity between the patient, the practice, the populations, and public health, right? Everything that we heard earlier in that fireside chat as well. And there's a lot of complexity to all of the different workflows and all of the different data elements and all of the different silos of knowledge bases that exist behind these workflows. I believe, however, that innovation done right makes technology invisible. So how do we go about doing that? I think it's pretty simple. So here it is. This is essentially my entire keynote in the back of the napkin, right? It is about moving from an environment that we all function in. So I'm a radiologist. We're data rich and information poor. I'm more of a detective than I am a clinician. I'm always piecing information together, and when I have, quote unquote, just enough information, I make a call and I say, this is what I recommend, this is the interpretation. Just enough healthcare isn't good enough healthcare. So how do we move from data to information, from information to knowledge, marry it with the context of what it is that we're observing the patient for, the socioeconomic data, the wants, the behaviors, all of the different elements, the moments that matter, the things that are really important to that N of 1, and get to wisdom. And the further up you move up in that pyramid, the further up that you actually move up in the value pyramid. So we talk about volume to value, and it just rolls off our tongue, but this essentially describes that. So it's uncanny what Larry talked about on the stage earlier. And this is what healthcare has been about forever, really. Not just in the last 30, 40 years that we've been rolling out digital, but for centuries at a time, healthcare has really been about sick care, and there hasn't been much care. So it's really been about sickness. So how do we really broaden that aperture and focus on preventative care? I think that's really critical. But beyond that, on well care, not just preventative care, but well care. And I think the pinnacle is this. This is about thriving. It's not just about surviving, it's about thriving. It's living your best life, that N of 1, that individual that has their own individual drives and motivators, those moments that matter to that N of 1. And I think that's really important. So we take that approach at Advocate Health. So Advocate is now one of the largest health systems in the country. We're third, fourth largest. We're 155,000 teammates, $32 billion annual revenue health system, still a not-for-profit, still on very narrow margins that we barely get by. But having said that, the impact that we can create, that we are creating as a result of the footprint that we have and the vast data elements that we have and the influence that we bring, I think is something that just inspires me every day. And in the center of that impact is you. It is that N of 1. It is that person. So I take not just a patient-centered approach to care, and I talked a little bit about this in our workshop yesterday, but more of a person-centered approach to care. So the patient is always in the focus. It's always in the center. But let's broaden that aperture. Let's take more of a person-centered approach to care. And that person saying, engage me, hear me, know me, right? All of the different elements of connected health and personalized care and quantified self, all the digital exhaust that's coming out of us on a day in, day out basis. Those are the ingredients of participatory health. So the question that always gets asked when you go to a doctor's office is, what's the matter with you today? Why are you here today? That's the wrong question that we've been asking for centuries at a time. The question we should be asking is, what matters to you? Right? And I think that's where AI really comes in. That's the power of artificial intelligence done right. But there is a lot of hype in AI. There's a lot of hype in healthcare. And everyone's familiar with the hype cycle around artificial intelligence. This is the most recent version from Gartner, the 2024 hype cycle. I kind of like the emoji version of the hype cycle. And I think it is quite accurate, if I can say so myself. Now, having said that, the reality is that, like I said earlier, we are data rich and information poor. And in 1950, just as Larry was hopping onto that bus and going on that global trot, it took 50 years for medical knowledge to double. In 1980, it took 7 years. In 2010, it was 3.5 years. In 2020, 73 days. I don't even know what it is today in October 2024. But I bet it's not 50 years. Right? What's really interesting is, as a radiologist, I've been using AI now for a while. Right? And we've had multiple forms of machine learning and artificial intelligence in radiology and access to us in healthcare. But it's really Gen AI in the last less than 2 years through the power of ChatGPT and other Gen AI capabilities that are now available to us through a web browser, through an app. The accessibility as well as the exponential leap forward in the computational horsepower is just amazing. Right? It took Netflix 3.5 years to get to 1 million users. It took ChatGPT 5 days. And ChatGPT now has over 200 million users. So I asked ChatGPT, and this is 3.5, I should have asked 4.0, how will AI affect the future of the workforce in healthcare? And it gave some really amazing answers, right? So it's really good at churning out insightful answers. But also at the same time, right, we got to be careful about how it is that it's doing this. It's interesting. This is a JAMA paper, and many of you might have read this already, but the JAMA paper found that when they asked a group of patients, do you prefer these reports, these documents that were generated by, and they didn't know that it was generated by AI, ChatGPT, versus a stack that was generated by physicians, they actually said, no, we prefer this one. It was the one generated by AI. And the reason they cited was they said it's more human. It's more empathetic. Go figure. Run for the hills, the machines are coming. So I was at the JP Morgan Healthcare Conference 20 years ago, 15, I think, 16 years ago with Vinod Khosla, right, Khosla Ventures. And he said, Dr. Shrestha, you're a radiologist. Run for the hills, the machines are coming. And I said, how much time do I have, Vinod? And he said, 5 years. I texted him 5 years to that day at a JP Morgan conference. He said, still here. My wife's a practicing radiologist. She's still practicing. The reality is that, and someone said this at the workshop yesterday, radiologists that are not using AI, essentially, will be replaced by radiologists who are using AI. And what we're seeing there is a dramatic increase in various types of growths, right? So reskilling, upskilling, and there's a lot of that happening at Northeastern around health professionals and health aides and STEM professionals and builders. But there are also back office functions and other jobs that will start to go down and eventually perhaps be extinct. There's a lot of AI out there, and I'm not going to go through this slide. It has lots of AI capabilities that are already available to our fingertips around clinical documentation, clinical AI, patient engagement, back office functions, and operative functions. More than 75% of the FDA-approved AI tools are in radiology today, just because of the variety of leaps forward that we've made in the last several years. But the reality of all of this, and John leads the charge in CHAI, the reality of all of this in healthcare is, how do we do this in a responsible and trustworthy manner? Right? Responsible AI in healthcare is really important, and the examples earlier around hallucinations just speak to that. In March of this year, we launched TRAIN, the Trustworthy and Responsible AI Network, and it is essentially under the umbrella of CHAI. So as CHAI defines the what, the TRAIN is one of many AI assurance labs that CHAI is propagating that really dictates the how. And what I always say is, look, the health ailments of tomorrow will not just be fought with x-rays and stethoscopes. It will, in fact, be cured with data and AI. So I'm going to end really quickly with the power of ecosystems done right. So we talk a lot about AI. We talk a lot about experiential elements of really pushing forward with the what and the how in healthcare. But I'm a big believer that in order to do this right, you have to do this with the power of partnerships done right. So here's an example. So at Atrium Health, which is now part of Advocate Health, right in the thick of the pandemic, we said, look, we're shutting our hospitals down. We need to make sure that we're caring for our patients, these COVID presumptive and COVID positive patients. And Colleen Hull from my team is here, and she's going to be on a panel later talking about our hospital at home program. But we stood up our hospital at home program at Atrium Health. This is 4 or 5 years ago now almost. And 2 years ago, we partnered with Best Buy Health to try to really grow this and scale this across Advocate and nationally as well. And we're focusing in on care at home and that ecosystem and saying, how do we bring the elements of technology and empathy? So think about the geek squad that comes to your home to hang a Wi-Fi TV and set up a Wi-Fi router. How do we train them? How do they work with our paramedicine folks and our virtual care specialists and look at fall risks and look at, is there food in the house? Is there a gun that's unlocked in the house? Is there domestic violence in the house? And how do we make sure that we're able to really serve up this future that I described earlier in the comfort of their home? And we're working with partners like Best Buy Health and others to really push forward with our construct of placemaking. So this notion of innovation districts is becoming a real one across the Advocate Health ecosystem. And we're connecting and amplifying these districts. We're creating these innovation hubs, and we're working to really push forward the boundaries of entrepreneurship but in this ecosystem with a variety of different partners. And working on talent pipeline, we're really excited to continue to explore with Northeastern the things that we can do, not just in Charlotte, but across the United States and beyond as well. We're creating our Advocate Health National Innovation Network throughout the multiple different states, both in the Southeast and the Midwest. This is an example in Winston-Salem, where we have our innovation quarter. Just last year, $1.6 billion in economic impact. This is what we're building in Charlotte, the Pearl, our innovation district, with what will be the most innovative medical school in the country being built in Charlotte, going live in 2025. Once we're done with this, 5,500 new jobs, 11,500 jobs across the region as a result of the activities in the Pearl. And we're flipping the curriculum in our medical school. We're bringing in design thinking, empathy-based learning. We're bringing in leadership and health equity elements and AI into the curriculum of the medical school. We're bringing in ERCAD North America, this experiential learning, surgical simulation, robotic, and AI institute. That'll be the focal point for a variety of different companies and systems to work together around robotics and minimally invasive surgery. And in addition to the placemaking, the physical placemaking, we're also building the metaversity, right? A place where you'll be able to collaborate and really learn, leveraging the metaverse for things like education and robotics and AI and what I call actionable empathy at a global level. So at the groundbreaking of the Pearl, I said, look, we all have a new job description today, and I'm going to share that with all of you today. And it is really that we are architects of ecosystems. So how do we do that, right? Going from patient to person-centered care, from hospital-based to the home, from volume to, obviously, value, from transactions, which is what we've been doing in healthcare. It's been transactional healthcare to experiential healthcare. From not just change, but really change management, because we think that's really important. And then artificial to augmented. And from competition to co-opetition, right? That is the power of the ecosystem that I described earlier. So there's nothing more than an idea whose time has come. And with that, I will cede the stage back to Jean. Thank you.